My name is Owen Linder, MD. I'm a fellow of the American College of Physicians. I've practiced in Florida for 30 years, the same location, some of the same patients. Because you've given me more time than I had prepared for, I'll try to be a bit germane to the conversation that was just held and tell you I am insured by a major insurance company for more than 10 years. It's regular indemnity insurance. I have one full-time employee who's been insured since she started working for me. Rather than the health care benefits, I would point out the real need for health insurance is that she was found to have cancer, so she went through radiation, chemotherapy, and surgery. I'm very glad that I was able to obtain small business health insurance about 10 years ago. I have that insurance because of a pre-existing condition. I couldn't have gotten it without being a small business. My wife and son are insured, well, two of my sons are insured under a health savings account, which we had for many years, even prior to my pre-existing condition. So that's by way of personal introduction. This is an example of what it's really about to me. In 1998, I began treating a 17-year-old native Floridian with a hereditary condition which makes boils in the sweat glands, in the armpits and the privates. Each month, she was afflicted by the painful boils. Her mother had been treated by surgical removal of the sweat glands in the armpits and the privates. A little closer. On 12/14/2004, as a young, self-sustaining adult working for a large company with large group insurance, she had her armpit glands removed, which solved part of her problem. But the frequency of pudendal abscesses continued unceasingly. By 2006, and out of a job, her goal was regaining a job with health insurance. She needed to have that surgery with the same skilled surgeon who knew her condition, knew how to operate on it, had operated on her armpits and her mother. Work as a nurse's aide was easy to find, but it was hard to keep a job like that. Reduced hours, extra job duties made it hard for her to comply. She lost a lot of jobs. She never got the health insurance. I think the rules were stacked against her. She got to the point the abscesses became groups of abscesses, taking over a large part of the area on which she sat. Antibiotics and drainage are only temporizing measures. So she tried to get disability 4 times, and she used a disability attorney. After 4 rejections on December 23, 2010, I wrote in the following fashion to the Office of Disability Determinations. Her social interaction and adaptive ability have only improved over time, as suffering has steeled her to the poor quality of her life. However, the constant pain in the center of her lower torso impairs her concentration, persistence, and pace. She took photos to the disability hearing. Verbal testimony was not necessary, it was granted. But here's what was granted. Because she wants to work, she ended up with share of cost Medicaid, a $900 monthly share of cost. Well, she couldn't pay out $900. By April 2012, the share of cost was $1,985. Now, in this period of time, a new treatment has come out. It's called Humira. It's transformative. It's still in off-label use. It's a patent cure. It runs at least $2,000 a month, depending on the dose that's used. The treatment with a knowledgeable physician in the use of Humira and the drug would exceed the threshold of the share of cost. But no Humira provider she contacted was willing to work with this program, knowing she would never be able to pay her share.
And sir, if I could ask you, and this is a very helpful story that you're relating to us and helps us make good decisions, but if you could conclude so we can hear from the other doctor, and then there's 10 people, I want to make sure we get time to hear them. So if you could conclude, and then if you have some written testimony, I'll personally make sure that it's copied and gets to every committee member. And I apologize for interrupting you. I just want to make sure we're fair to the other people who would like to speak.
It's my understanding that Medicaid only covers people who are at the 20% federal poverty level, and that's for unemployed adults with children. Employed adults with children are only covered up to 50% of the federal poverty level, and then there's this tremendous gap, which is very hard to meet. If we had continuous Medicaid, instead of having to pay the share of cost every month, then this person wouldn't suffer. The Medicaid expansion meets the income threshold, is extended to cover more working Floridians. And I shall quit.
Go ahead. Do the next one.
Thank you, Dr. Linder. Is Dr. Fiorani here?
Yes.
Lawrence Fiorani. The theme of today's meeting is basically how does the Affordable Health Care Act impact employers, and physicians could be self-employed, or they could be employed by groups, and how does this impact your profession? So personally, I'd like to see how the Affordable Care would impact your profession as well.
All right, thank you, Mr. Chairman, Madam Vice Chair. I'm Dr. Lawrence Floriani from Tarpon Springs, Florida, and I'm a member of Doctors for America, which is an organization that's committed to place patients over politics. I'm here to speak to you about the benefits of the Medicaid expansion on the public health and also on Florida's employers and employees. Florida has 3.5 million uninsured adults and 500,000 uninsured children, the third highest in the nation. The Medicaid expansion will provide insurance to those children, but also to more than 1 million adults. Out of those adults, about 2/3 are working low-income earners who support our tourist industry, primarily in service-related jobs. And over 300,000 of them are parents. Lack of insurance carries a 6% higher mortality rate. Medicaid expansion could prevent 3,900 deaths per year in Florida. Adults are more likely to seek medical care when they're insured, and less likely to have to borrow money or stop paying bills, other bills to pay for medical care. Children whose parents are insured have better health and live in more financially stable homes because health insurance dramatically reduces medical debt in families, the #1 cause of personal bankruptcies. The effect on the workers of Florida, adult workers without children today are not eligible for Medicaid in Florida. In the future, those who earn less than $15,000 will also not be eligible for federal subsidies, and that group of almost 1 million low-income workers will be uninsured. On the other hand, the health coverage that the expansion provides to Florida workers would be a fully subsidized employee benefit to small business employers that's estimated to be worth over $14 billion to small business employers over a 10-year period, providing a dramatic increase in productivity due to a reduction in illness-related absenteeism. Now, what will this cost Florida? The Medicaid expansion is fully covered by the federal government from 2016 through up till 2016, and then 90% from 2020 on, and it's estimated we will spend $250 million a year. On the other hand, there are savings on uncompensated care payments, drug and mental health treatment programs, and the very expensive medically needy program that are estimated to save more than the cost of Medicaid and actually produce a net savings of $125 million per year. The Medicaid expansion eliminates the hidden tax on health insurance policies. that employers pay for their employees. For the state of Florida alone, it's estimated that the state and local governments could save over $100 million a year in reduced premiums for state and local employees. This will also carry over to non-governmental employers. There will be a profound effect on hospitals, which are one of our largest employers in the state. Florida hospitals may lose up to $1.7 billion combined due to reduction in federal DSH funds, federal matching funds for our low-income pool, which will expire in 2014 due to the Medicaid expansion, and the additional Medicaid payments that would have come from the expanded enrollment. Hospitals may lay off workers or they may close.
And Doctor, if you could, when we made sure that we have copies of your testimony that have been distributed to all the committee members, if you could maybe hit your best point and conclude, and then I want to make sure these 10 speakers can all speak.
All right.
Thank you, sir.
Just briefly, the federal government will spend $27 billion over the next 10 years in Florida, which will increase labor income by $3.1 billion and produce enough indirect business taxes to offset the entire cost of the Medicaid expansion. To Senator Sobel's question, I am a small business employer. I have a few employees. I have a small business plan from Blue Cross Blue Shield. 2 years ago, my premiums went down 1%. Or last year, they went down 1%. I received a $300 rebate check, and next year my premium is 4% lower. And that's due to the Affordable Care Act. Thank you for allowing me to speak.
And I want to thank both of you, and thank you, Senator Sobel. Thank both the doctors, and thank you, sir, for your recitation of that situation and your thoughts on how we can address that in a proper manner. And I know both of you took time away from your practices to come to Tallahassee, and we appreciate your time.